It says we're on YouTube now, though, right? I see it on my end. Okay. Anything else, ma'am? Anything else, ma'am? We're all set? All right. Okay. All right. Go ahead. Say what you need to. Okay. All righty then. Senator. So good morning, everybody. We're going to call the Appropriations Committee public hearing for March 5th to order, and we're going to start with Senator Perillo. Senator, the floor is yours.
Looks like it's just us, Senator.
It's okay.
This will be very
Be
conversational.
intimate.
So, Madam Chair, I am here to testify in favor of SB 20, which increases per diem rates, as stated in the title, for the State Board of Labor Relations folks. But I do want to point out, this was a request of mine, and I appreciate you and leadership of the committee bringing it forward. Interestingly, the original intent was not necessarily related to the Board of Labor Relations, though they are long overdue for an increase. The original intent was actually for the State Board of Mediation and Arbitration, another organization of folks who give a lot of their time to the state of Connecticut to do very, very important work. Yet they have not seen an increase in their per diem since 2017. So we're going on almost 10 years without an increase, and as we all know, we have seen quite an increase in the cost of living since then, and it's not a ton of money. We're asking to go from $325 to $500, so it's not a massive ask, and obviously there will be a fiscal note associated with it, but it's not going to be that big. And you've got a very ambitious agenda and a lot of changes, and you've been given a budget that quite honestly doesn't have this change in it, and I appreciate that by the governor. But I did want to at least bring that to your attention. And like I said, anything that the committee can do to include the State Board of Mediation and Arbitration would be greatly appreciated, not just by me, but obviously for the folks that are doing the work.
Okay. All right. Are there any comments or questions? I do have some people online that are listening to us, Senator.
So it's not just us. Okay.
It's not just you and me. There are a number of other people online. Do you know how many people are on mediation and arbitration off the top of your head? If not, I can have
They do about 46 cases a year,
Okay.
so it's not a ton of people.
Okay. All right. Well, let's see what we can do.
Thank you, Madam Chair. I appreciate it.
Thank you. Have a nice day. Up next is James Farrellis, Continuum of Care, President and CEO. Floor is yours, sir.
Good morning, Senator Austin, Representative Walker, Senator Summers, Representative Nuccio, and honorable members of the Appropriations Committee. My name is Joe Browlis, and I'm President and CEO of Continuum of Care in New Haven. I'm here this morning to urge you to fund HB 5202 to sustain the emergency housing program currently funded with ARPA funds to expire in June of 2026. ARPA funding was utilized to open and operate the emergency housing program in New Haven. Without continued funding of $1.5 million annually, or what comes down to $41 per day per person, 100 current clients, including those who are elderly and medically compromised, will have to leave, and even more will not have the benefit of these services in the future. Since December 2023, Continuum has operated a 100-bed non-congregate emergency housing program, the first of its kind in Connecticut, serving residents from New Haven and the surrounding towns. The program is not a traditional shelter. It's designed to provide comprehensive services, particularly for unhoused adults challenged with complex needs. I've worked in the field of homeless services and with individuals living with mental health and substance use disorders for over 35 years. For years, we witnessed steady progress and homelessness actually declined. However, in the last 5 years, that progress has reversed. Rising rents, a severe lack of affordable housing, and low inventory have forced more and more individuals to become unhoused. What is most alarming is who we are now seeing. Nearly half of the individuals we serve are over the age of 60. In fact, our oldest guest was 87 years old. And of those elderly, more than 40% are first-time homeless, coming in at that age due to the factors I just mentioned. Region-wide, more than 30% are over the age of 55. Many arrive with or need walkers, wheelchairs, or oxygen tanks, and others have complex chronic medical health conditions. They are not only unhoused, but they're also medically fragile. Finding deeply affordable housing is difficult enough, but finding ADA units is nearly impossible. Continuum's emergency housing program is uniquely designed to serve this vulnerable population. Individuals are referred through the Coordinated Access Network, the CAN, and those who are most medically vulnerable and behaviorally complex tend to be referred to our emergency housing program because we have the staffing, the accommodations, and the clinical expertise to meet their needs. The CAN also refers, and we serve individuals not just from New Haven proper, but from the 19 towns surrounding New Haven. The results are clear. The rate of return to homelessness from our program is approximately 15%, while the rate for traditional shelters exceeds 60%. Along with traditional housing resource navigation and case management, the intentional design of this particular program includes the following: private non-congregate units serving couples and individuals with pets, individual behavioral health services integrated, on-site access to nursing and clinical services, and 24-hour on-site staff for around-the-clock engagement, assessment, and stabilization. The cost of allowing this program to disappear will far exceed the cost of sustaining it in terms of human suffering, hospital utilization, public safety, and lost progress towards reducing homelessness. Sustaining this funding means preserving an effective model that protects some of the most vulnerable members of our community while reducing long-term costs to the state. I respectfully ask for your support to ensure that this critical program remains beyond June of 2026. We also have residents who will be attending this hearing this morning, and I welcome you all to meet with some of them. Thank you very much.
Thank you. So before you go,
Yeah.
you said 1.5 million annually for your program, right? Not for
Correct.
all continuum of care.
Correct.
Thank you. I just wanted to make sure that that was clear.
Thank you.
Thank you. Any other questions? Seeing none, you're all set. Up next is Joseph Sokolov, Bridgeport. How are you?
Good morning. Greetings, members of the Appropriation Committee, Senator Olson. My name is Joseph Sokolovic. I am a member of the Bridgeport Board of Education and the Vice Chair. Before I begin my testimony, I would like to thank you personally, Senator Olson, because you were one of the first to recognize outside of Bridgeport that the Bridgeport problem is a funding problem, and we definitely need more funding. So now I'm just going to dive into my testimony. It's on the school breakfast, on the school meal program. No child should ever go hungry. In Bridgeport, hunger is not theoretical. In reality, feeding children is definitely a moral responsibility. However, good intentions do not excuse poor policy. HB 5144 proposes to expand free school meals by shifting costs. In doing so, it weakens educational assistance that urban and rural districts rely on every day. Low-income students in Connecticut already qualify for free breakfast and lunch. This is true across all districts, regardless of the district's wealth. For Bridgeport and similar communities, children already receive free meals. HB 5144 does not expand access for children in poverty. Instead, it creates a new subsidy that disproportionately benefits wealthier districts. This results in a regressive redistribution of resources. This happens under the guise of compassion, while communities that have carried this responsibility all along gain little and ultimately pay the price. The most troubling aspect of this bill is how it's funded. Just 11 lines away in the budget, rather than being supported by new revenue, it's offset by cuts in RESCs. RESCs provide critical services, including special education support, magnet school operations, and shared services that under-resourced districts desperately need. When RESC funding is reduced, districts are forced to pay higher tuition costs. This means that while the state pats itself on the back feeding children in the morning, it simultaneously picks the pocket of supports that help students learn throughout the school year. HB 5144 reflects a familiar election year pattern: a simple, emotional, powerful promise, a feel-good headline, and a funding mechanism that shifts harm. Free breakfast for all makes for great sound bites on the campaign trail. Cuts in special education, transportation, and shared services do not. Governing requires honesty about who benefits and who pays. This bill asks districts like Bridgeport, Hartford, New Haven, New Britain, which have fed hungry children for years, to sacrifice again so that wealthier communities can receive a new benefit. This is neither equitable nor responsible. School meals are essential, humane, and necessary, but they are social services and add nothing to the operating budget of our schools. This cost does not belong in the education operating budget, especially when funding them requires cuts to core educational services. If Connecticut believes universal meals are a priority, as I do, they should be funded through social services, health, or child welfare budgets. Education dollars should be used to educate children, not as a backdoor funding stream for a new social service. Connecticut can, Connecticut can address hunger without weakening education, without reducing cuts to risks, and without shifting harm onto communities with the greatest needs. Until this proposal is properly funded, restructured, and removed from the education budget, I respectfully oppose 544. Feeding children should unite us and not divide districts or undermine equity. Thank you.
Thank you very much, and thank you for your comments. I also am worried about the school meal cost. I'm not worried about the policy because I agree with the policy, but I want to make sure that we're putting the correct funding in so that it is not rolling back onto the school budgets relative to that. Representative Walker and I have had a lot of conversations about the school meal issue, agreeing with the policy, but not necessarily believing that the funding is all there. So I think that that's something that we're going to continue to look at all throughout the next couple of weeks, and thank you. Anybody else have any comments? You're
Thank you.
all set, sir.
Have a great day.
Up next is Kate Mazzata. Kate, you know the drill.
Better than we do.
Senator Austin, Representative Walker, Senator Summers, Representative Nuccio, Vice Chairs, and esteemed members of the Appropriation Committee. Thank you for the opportunity to testify in front of you today. My name is Kate Mazzata, and I am the Policy and Research Associate with the Connecticut Children with Incarcerated Parents Initiative, or CTCIP. I am here with my colleague, Irvine Pexagaya, the project lead of CTCIP, to testify in support of HB 5144, an act concerning funding for school meals. At CTCIP, we are interested in the holistic support of children who are impacted by parental incarceration, also known as CIPs. An often overlooked consequence of parental incarceration is food insecurity. 1 in 14 children across the United States will have an incarcerated parent at some point during childhood. Most formerly or currently incarcerated people are parents, and their absence while incarcerated and the barriers they face when they come home have ramifications for their entire families, particularly children. A study in 2019 found that 20% of formerly incarcerated people reported suffering from food insecurity, double that of the general population, and even higher rates among formerly incarcerated women and Black individuals. A 2016 study found that parental incarceration increases the likelihood of household food insecurity by at least 4 percentage points. Children who lived with their parents pre-incarceration were more susceptible. Providing funding for free and reduced price school meals is imperative to the academic and societal success of children and combats food insecurity. Research shows that receiving free or reduced price school meals reduces food insecurity, obesity rates, and health problems among school-aged children. According to one estimate using national data, receiving reduced price school meals can reduce food insecurity by at least 3.8%. In Connecticut, the most food insecure regions are Hartford, Bridgeport, New Haven, and Waterbury. Similarly, just over 45% of Connecticut's CIPs are in Hartford, Bridgeport, New Haven, Waterford, and Stamford. While these data points focus on the bigger cities in Connecticut, CIPs are everywhere in the state. HB 5144 has the chance to help children in rural areas, smaller towns, and the children whose parents or caregivers make too much to qualify for free school meals, yet they are still left hungry. We strongly urge the committee to pass HB 5144 and to include the appropriate amount of funds in the budget adjustment bill. The passage of this bill can help combat the detrimental collateral consequences for children across the state caused by the intersection of food insecurity and parental incarceration. Thank you again for the opportunity to testify today. We are happy to answer any questions members may have.
Did you get the numbers on what it would cost us for the school meal program? Because I think it's more than 12 million.
Really,
I'm asking a question, not you.
Public hearing, you're not supposed to ask questions.
I know, I'm just trying. There are 24 people.
I don't have that, but we're more than happy to get that to you.
If you could get that to us, that
Yeah.
would be great. Thank you. Anybody else? Seeing nobody, Representative Walker.
Thank you very much for your testimony, and thanks for all your work. And you want to introduce yourself, ma'am?
Yes, hi, thank you so
You got
much.
it.
Yeah.
Thank you so much, Representative Walker. My name is Irvine Pexagay, and I'm the project lead for the Connecticut Children with Incarcerated Parents Initiative.
Awesome. Thank you. Thank you for your testimonies. Thanks.
Thank you. Okay, you guys are all set? Up next is Drew Michael. Drew Michael here? Drew Michael McWeeny.
Madam Chair, we have someone online using their cell phone. If you could please ask that they identify themselves. on
What's the
committee.
cell number?
The cell number is 203-814-7750.
With phone number 203-814-75
7750.
7750, identify themselves.
Going once, going twice, gone. Click. Next.
Okay, you're up, sir.
This is Senator Austin. This is Rep. Tina Corpus. I am this phone number that was asked
Oh,
about.
okay. Thank you, Representative Corpus. Appreciate you.
Thank you.
Did you get that?
Turn your mic.
And you've got to turn your mic on. There you go. Now you can do your speech.
Awesome. Thank you. Good morning, everybody. My name is Drew Michael McQueenie, and I'm Assistant Professor of Early Childhood Education and the Program Chairperson of the Early Childhood Department at CT State Norwalk Community College. I'm writing to oppose SB 19, an act concerning funding for school-based mental health services in certain rural areas. While this bill is framed as support for students, and I do support the premise that we need school-based mental health services, I don't believe this reflects equity in educational policy. The reason why is because it directs state general fund dollars exclusively to rural districts in the northwest part of the state, rather than addressing student mental health needs across all communities. I don't believe it includes similarly situated districts elsewhere in Connecticut that are also experiencing reductions in federal funding, nor does it consider districts with higher student populations, higher poverty rates, or greater concentrations of high-need students. Urban and suburban districts alike are facing increased mental health crises, staffing shortages, and funding instability. Limiting appropriations to one geographic region excludes equally vulnerable students elsewhere. Equity means fair. And if we apply this concept of fairness to the bill, then fairness means allocating resources based on demonstrated need, not geography alone. If the purpose of state funding is to ensure that every child has access to adequate mental health services, I believe funding decisions must be guided by transparent statewide criteria that can include, but not limited to, student population, poverty levels, special education rates, or even documented service gaps. When funds are restricted to a specific region without a broader needs study, the state creates an imbalance rather than a correcting one. So as an example, what makes Goshen Center School in Goshen, Connecticut, which is a rural school district, any different than Wakely Elementary School in Wolcott, Connecticut, a suburban school? So both these schools suffer the same issues. I only say that because I student taught in Goshen many moons ago, and my kids go to the Wakely Elementary School in Wolcott. Connecticut has long affirmed its commitment to equal educational opportunity, and I believe fairness requires consistency. So funding decreases in one region, then that challenge may be mirrored in others. A policy response that benefits only one area reinforces the notion that access to state resources depends on location rather than student need. And then it sends a message of favoritism. I don't dispute that rural districts in the northwest part of Connecticut are experiencing real funding pressures. There's students deserve support. However, so do students in Woken and every other district across Connecticut that face similar reductions and rising mental health demands. I do acknowledge that rural districts do face barriers such as provider shortages and transportation challenges, and while I know this to be true, those factors should be incorporated into a statewide funding formula and not addressed through geographically isolated appropriation. So in conclusion, should the state believe that federal reductions require intervention, I believe that the appropriate response would be a comprehensive needs-based strategy that would apply pretty fairly. So I just want to be clear, I'm totally for the premise of school-based mental health services, 100%. I just want to make sure that if the people want equity, I think we should make it fair and apply it to everything. So I really appreciate your time, and I'm happy to answer any questions you might have. Thank you.
I don't think we have any question. I would just say out loud that in many parts of the rural part of the state, no matter how much we try, unless we call out for help in rural areas, we don't get any services at all. And so that's when you say that the others deserve care also, they are getting that care. And the school-based mental health services deserts show up in the northwest corner, which has a little bit more usually has more financial wherewithal than the eastern part of the state, which has a lot more poverty. But no matter how hard we try, we don't get the services associated with mental health care. So that's why the call out here is in here, and the senator who represents this area asked for us to look at this, and so we said we would. But if we're not going to give anything to the rural areas, we have to also understand why we're not doing anything there when the other parts of the state, the school-based health centers are more prolific in other components of the state. But I don't disagree with your concept.
Yeah, I would echo you on a point that you made that I can agree with. You know, we give a lot of the money to Waterbury, to Bridgeport, New Haven, and I hate to say it, but look at a lot of the results. You know, I think what some people miss is that just because you give money to a school district or a facility doesn't mean the outcomes are automatically going to be good. It's what you do with the money that really makes the difference.
You're
so I
talking
agree
to my colleagues. That's music to her ears. That's what she says all the time.
I just think
Results-based
we have to
accountability.
be, I just think we have to be smarter with finances.
Right.
I think that as long as we have fiscal responsibility at the forefront, then as I said, I support the premise that we need, to help our rural areas. My argument is that we can do a little bit better by not only reaching the rural places, but also fixing as well. Well, we get all this money to Bridgeport, and it's not really that well. So if we can do it for our rural friends, then we can do it for others. So yeah, I would agree on that point.
All right. Anybody else? Representative Dathan.
Thank you so much, and thank you for coming all the way up from Norwalk today on this horrendous drive up. Really appreciated. I represent Norwalk, so it's good to see, and the community colleges in my district. So I'm really pleased for that. But one of the questions I had is within your sort of professional capacity and working with other of the state colleges, do you all do any sort of work to do sort of a student to mental health counselor by district? Do you have any information on that? Because I think going back to what the good chairperson was saying is we have a better student ratio in our urban districts than we do in our suburban districts. And when you have a school counselor or social worker that has 100 students under their case management, it's really difficult to provide meaningful services to folks. And I think the aim of this bill is to really make sure that we think about that sort of ratio and how we can be better effective, especially when so many of our young people are having sort of after effects of COVID or learning disabilities. And it is important that we make sure that everyone in the state receive services no matter what their zip code is. So I think that's the premise behind it. I hear you. I hear in Norwalk how we need more school counselors, and case management does need to improve in our school system. But I'd be interested if you've talked to your community and your fellow professors and other of the CT state community colleges to kind of talk about that sort of ratio.
Yeah, and in fact, I would echo your point that, I just had a conversation last week with a couple, and they had mentioned to me that there seems to be a increase in interest for going for degree programs in mental health, school counseling, like marriage and family counseling. So one of the things that I'm going to be trying to put together at the forefront is a pathway for our early childhood students and other related people to kind of get that transition, some coursework in those areas, and partner with different districts to be able to place them in those. So that, because I really think, as from an educator preparation perspective, that the only way we can retain good quality people to go in and do this work is that if they know what they're getting into, and we can, I hate to say, we can weed out those that shouldn't be there and those that should. So I think the conversation at the community college level when it comes to how we can get this to happen starts with the training aspect. So I think personally, if we can address the training aspect, I think we can soar with this.
I'm so proud to have you in Norwalk. So thank you for your work, and I fully agree with you, and I'm so glad to hear that there is a focus at this at the community college level.
Yeah, and I want to make very clear, by no means is my testimony today shaming any of the urban school districts. I started my career as a teacher in the Waterbury School District, and I lived in Waterbury for a long time. So I appreciate everybody's work with this and furthering that conversation. So thank you very much.
Thank you so much. Thank you, Madam Chair.
Representative Reyes.
Thank you, Madam Chair. Good morning. Thank you for your testimony. I have the distinct privilege of representing Waterbury, so I would just
Awesome.
I will continue the conversation with you on the side. But
Awesome.
I would like to ask you, so do the children from Woken, are they bused to Waterbury for some of these services that you're saying you're not getting at Wakely?
Yes, so no. So right now, our district is very, really only has very few psychologists, school counselors, and I'd say Weekly Elementary School, there's one psychologist. There's no real counselor, school counselor, like the traditional schools will have, like a social worker. One of the social workers is shared between multiple schools. So it is difficult.
How many schools, please?
We have 3 elementary schools in Wolcott, 1 middle school and 1 high school.
And one psychologist?
For the elementary schools, there's 1 in each building.
Okay.
Yep, 1 in each building. There's 1 in the middle school, 1 at the high school, and yet the amount of students that have mental health needs is rising. So in other words, those people feel just so overwhelmed with the amount of students that are, in need of these.
No, I can understand your reflection on more money doesn't necessarily mean better outcome. I can understand that. But representing a city that right now is probably the 14 to 16 million underfunded. So I want to continue the conversation with you off limit, but I also want to ask you, are you familiar with Wellmore Services in Waterbury, Connecticut?
Yeah, I am.
As a supplement?
Yeah, I'm familiar with Wellmore. I believe Community Mental Health Affiliates 2 is in downtown Waterbury.
Yep.
Mm-hmm. Yeah,
All
so
right,
I'm
that's awesome.
familiar.
Thank you for your testimony this morning. Thank you, Madam Chair.
Thank you. Appreciate it.
Thank you.
Yeah.
Anybody else? Seeing nobody else? You're all set. Up next is Aaron Bizzuto. Online. Aaron, are you on?
Yes, hi, Madam Chair.
Okay, go ahead. The floor is yours.
Dear Co-Chair Senator Ostin and Representative Walker and distinguished members of the Appropriations Committee, my name is Aaron Basurdo and I'm a graduate student from Yale School of Public Health in New Haven. I am testifying in support of House Bill 5144, an act concerning funding for school meals. This issue is important to me because funding universal free school meals would have long-term effects for students across Connecticut. Food insecurity remains a serious challenge in our state, affecting thousands of children who arrive at school without consistent access to nutritious meals. Even short periods of food insecurity can disrupt concentration, attendance, and overall academic performance. I care deeply about this bill because I have seen firsthand how different policy choices shape student outcomes. Growing up along the border of Texas and New Mexico, I witnessed two contrasting approaches. Texas does not provide universal free school meals statewide, while New Mexico does. The difference was visible: higher participation, less stigma, and more students starting the day ready to learn. As a health policy student, I am particularly interested in the financial returns of state investments and the role of preventative care in health policy. Universal free school meals is a preventative intervention. It supports children before academic gaps widen and before health conditions become costly to treat. Policies that strengthen child nutrition are not just social supports, they are economic strategies that directly affect the next generation's educational attainment, workforce readiness, and long-term health. We have clear regional precedent. Massachusetts and Maine have made universal school meals permanent after observing participation growth and greater fiscal predictability at the district level. When meals are offered at no cost to all students, districts report simplified administration, reduced unpaid meal balances, and more stable program budgeting. Massachusetts analysis demonstrates that higher meal participation directly increases federal reimbursement flows into the state. If Connecticut increases participation through universal free meals, we similarly strengthen our ability to draw down additional federal funds. Universal free school meals function as preventative care. A recent systematic review published in JAMA Network Open found that universal free meal policies are associated with reduced childhood obesity prevalence, fewer school suspensions, in addition to increased meal participation. These findings suggest that removing cost barriers improves both health and educational stability. In addition, longitudinal research from the University of Washington evaluating schools participating in universal meal programs through the community eligibility provision found a 11% net reduction in high blood pressure among students over 5 years. High blood pressure is a childhood predictor of long-term cardiovascular disease and future public health expenditures. Early nutritional intervention is significantly less expensive than treating chronic disease later in life. In conclusion, I urge you to favorably vote this bill out of the Appropriations Committee. Thank you for your time, and I'm happy to answer any questions you may have.
Anybody have any questions? Thank you. I'm sorry,
Yeah.
Representative Dillon. Representative Dillon.
Well, thank you, Madam Chair. I just want to thank you for, as a graduate of the public health school myself, I want to thank you for taking the time to testify on this important issue. And I believe students from the public health school and the med school also are taking blood pressures at Loaves and Fishes on Saturday morning and doing other kinds of outreach to the community. That was not, I'm not criticizing anybody, but that was not the case when I was there. And so I'm really excited that you're taking the time to be here, and I want to thank you.
Thank you, Representative Dillon. Yeah, I volunteer in a free clinic every Saturday, so it's been really exciting to see kind of the community impact of that. So thank you.
Thank you.
Seeing nobody else, you're all set, sir. Up next is Jim Williams. Is Jim Williams here? Hey, Jim, the floor is yours.
Yes, good morning. My name is Jim Williams. I'm the Government Relations Director for the American Heart Association in Connecticut. We are the nation's oldest and largest voluntary organization dedicated to fighting heart disease and stroke. Our mission is to be a relentless force for a world of longer, healthier lives, and we take our mission very seriously here in Connecticut. I would like to thank the leadership and members of the Appropriations Committee for providing me with the opportunity to provide brief comments today in support of House Bill 5144. The American Heart Association strongly supports funding that gets us closer to healthy school meals for all students free of charge, regardless of family income, which this bill does. In fact, not only do we support free school meals for all students, according to a recent poll conducted by the Stats Group entitled Connecticut Public Opinion Poll School Meals Survey, so do 93% of Connecticut adults. I'd like to spend the remaining time, my remaining time, to briefly share some of those highlights from the poll. As I mentioned, the vast majority of Connecticut residents support a new law that would have schools provide no-cost healthy meals. 93% support this, and fully 73% strongly support it. 7 in 10 Connecticut residents regard lack of nourishment among Connecticut school children as a very serious problem, and 2/3 say it is a very serious problem that children are not learning how to eat healthy foods. I might be the only person you hear from today who is also going to offer you a funding solution for this. Finally, the poll looked at a unique way the state could fully pay for healthy school meals for all. There was 80% support among Connecticut residents to establish a 2-cent per ounce sugary drink tax to fund meals for Connecticut children. The final report for this poll has been emailed to many of you, and I have also provided it to the committee clerk as additional testimony for this hearing. A few additional reasons to support healthy school meals include, according to Feeding America's MAP and Meal Gap, on average, healthy school meals for all would save Connecticut families approximately $147 per student per month, or approximately $1,320 per student per school year. Students who eat school lunches tend to take in more whole grains, vegetables, and dairy, and fewer refined sugars and empty calories than those who bring their lunches from home. And students who have more nutritious diets tend to perform better and pay more attention in school. I'd be more than happy to answer any questions that you have now or at any time in the future. Thank you for your time.
Thank you. Are there any comments or questions? We have none.
Thank you.
Thank you. Up next is Joe Almond. Joe Almond, are you here?
Madam Chair, I believe they will be joining us shortly if you would like to move on down the list.
Okay. Daniel Fitzmaurice, online. The floor is yours, sir.
Good morning, everyone on the Appropriations Committee. This is Daniel Fitzmaurice, Director of Advocacy at United Way of Connecticut. I'm here today to support House Bill 5144, an act concerning funding for school meals. United Way tracks financial hardship across Connecticut through our annual ALICE research. ALICE stands for Asset Limited, Income Constrained, and Employed. These are households that are working hard in critical jobs for our communities, but they still struggle to afford the basics like housing, food, childcare, and transportation. The latest data shows that at least 581,000 Connecticut households fall below the ALICE threshold. That's the highest number we've ever recorded. There are ALICE households in every single community in our state. But what's particularly striking is that the sharpest increases in financial hardship are now in our suburban and rural communities. Towns that typically pride themselves on financial stability are now home to a growing number of families living paycheck to paycheck. For families with children, this affordability crisis is particularly challenging. Every morning, parents and caregivers face an impossible balancing act with their budget. Housing costs are fixed, car payments are fixed, childcare is fixed. These bills don't bend, but food does. So when money gets tight, we hear all the time that families cut back on groceries. They buy less food, they choose less nutritious options, or they skip meals altogether. No-cost breakfast for all students and no-cost lunch for reduced-price eligible families lifts a real and recurring burden off these households that are already stretched to their limit and ensures that every child starts the school day fed and ready to learn. We already know this works. So many families across Connecticut benefit from federal funding that makes school meals no cost in their schools. These families always affirm to us how impactful this is, saving them critical dollars every week in their budget and less worry about whether their kids have enough to eat. This bill simply extends that same relief to families across our state who need it just as much. So we urge this committee to take this important step forward to expand no-cost school meals for Connecticut's children and families this year. Thank you.
Thank you. Are there any comments or questions? Seeing none, you're all set, sir. Up next, Meg Horgan, are you here? All right. The floor is yours.
Good morning, and thank you to the whole Appropriations Committee for this opportunity to testify today. I'm Meg Horgan, New Britain resident and co-founder of the Connecticut Food Sovereignty Collective. We're dedicated to building power for regenerative, interdependent, democratic food systems that nourish everyone. We urge the Appropriations Committee to amend HB 5144 concerning funding for school meals to fund free breakfast as well as school lunch for all Connecticut students. And there are so many reasons why feeding every child free, healthy school meals, regardless of income, including children from higher income households and school districts. The first being that there are food secure, but also financially insecure and close to financial insecurity, that ALICE population that was spoken about earlier, in every single school district and legislative district. Our present food system conditions include 1 in 6 children being food insecure, food prices rising steadily every year, and slashed federal benefits. These conditions are so unfavorable for most of us that everyone benefits from being able to count on healthy, free school meals. The increase in demand at food pantries and mobile food distributions throughout Connecticut shows that anybody can be suddenly thrust into food insecurity, and so children should be able to rely on healthy free school meals when this happens. Most people call our present situation an emergency, but food insecurity is actually a decades-long systemic problem in Connecticut that has increased sharply over the past 6 years, and we need these systemic solutions to address these challenges. While we spend another year debating whether rich children deserve to eat free food next to poorer classmates, the food system grinds along, employing parents at poverty wages and increasing them onto more restrictive federal nutrition programs. And while we argue over whether we can afford to feed children healthy food grown by our farmer neighbors, corporate national food systems continue to consolidate and outcompete smaller producers, threatening Connecticut farmers and worsening children's health. We must systemically improve school food by increasing local food purchasing, sourcing Connecticut school meals with Connecticut-grown food to improve nutrition, quality, and appeal, and lifelong good eating and economic habits. If just 15% of school food purchases supported Connecticut farmers, school meals could infuse millions of dollars into the local economy. And we've had about $9 million of cuts in local food purchasing from the federal government. Students of all income levels benefit from healthy, locally grown food, which also presents learning opportunities in local agriculture, including the sciences and career opportunities. And they grow into adults who support and participate in local agriculture and the economy and local community food security. Universal school meals made from local food benefits everyone. We can nourish Connecticut children while supporting Connecticut farmers. So please expand 5144 to fund universal school meals in addition to breakfast, and we can also do additional local food purchasing. We feel that this can be funded through a fair share tax like they've done in Massachusetts. It's a tax on income over $1 million. They've used it to fund school meals and a lot of other education and infrastructure spending. We can do this without raising taxes on working people, and we can do this by both feeding children and investing in the local food system. Thank you.
Thank you. Any comments? Seeing none. Representative Walker.
Yeah, one quick question. You talked about the food grown, local grown.
Yeah.
Sorry, early. Was that a program that you have that you?
Well, so we do have the Connecticut Grown for Connecticut
Right.
Kids grant program, and that's a fantastic
that's the
example. I'm
similar.
just using that as an example. The impact of that has happened, on a case-by-case grant basis. And
Right.
to me, it shouldn't come down to, is somebody at your school good at and seeking and can take care of a grant to make sure that a kid at your school is eating local food. Every Connecticut student should have the opportunity to eat Connecticut-grown food. And if we could do this systemically by saying, 15% of the school meals program has to be sourced from Connecticut, that would be both nutritional gains for our students and economic development for farmers and the local economy as a whole.
Thank you. I like
Yeah,
that.
thank you.
Anybody else? You're all set.
Thanks.
Up next is Amari Brantley. Amari Brantley. Okay, the floor is yours, sir.
Good morning, distinguished members of the Appropriations Committee. My name is Amari Brantley, and I have the honor and privilege of serving as the policy coordinator for End Hunger Connecticut. And that means I am a leader or steering committee member of the School Meals for All campaign for Connecticut students. All day today, you've heard, or morning, I'm sorry, I'm talking about all day. I got to be here all day. All morning, you've heard distinguished stats about school meals. Right, so I'm not going to flood that. I'm going to try to answer some of the questions that you asked and tell some personal stories about Connecticut that I've learned. Last year I started this job. First job out of college, to be honest with you. I came back from Arkansas, which is the most food insecure place. And it touched me and it hurt me to understand that food insecurity is going on in my own state at high percentages, from 14 to 16%, to where 1 in every 6 students that walk in our Connecticut classrooms are food insecure. It hurt me when I got to connect with some of my classmates that I went to high school with, where I had conversations with them and their teachers, and they tell me stories about how they have to create secret code names to direct students to closets to get granola bars in the morning because they didn't have the opportunity to get meals. Every kid remembers that time that they got money for their birthday. I do, and I let my mom hold it, and she, I never saw that money. But those were some of the most privileged memories. Earlier this week on a hearing, I heard about a student who has to save that birthday money because he's scared that mom and dad can't afford groceries. Or at the end of the school year, he's scared that they're not going to be able to pay that bill for school meals. School breakfast and school lunch is a lifeline to all of our Connecticut students. When you think about districts all over Connecticut, we see that at the end of the year, certain school districts have to turn around and come back to state government because they need grants that cover school meal debt. Because here, no matter what in our state, we feed every student every meal. I ask you, if cafeterias were built for every student, why can't every student afford to eat in them? Why can't every family afford that? This is a policy that's going to affect approximately 188,000 students across Connecticut, across all of our districts, no matter what. I leave with you this message. Or I talked about that, hold on. School breakfast will bring upon better attendance, improved concentration, stronger classroom behavior, and higher academic achievement. If you ask a superintendent what's one of the most important things on test days, they're going to say making sure that our students come into school fed and are ready to take those standardized tests that are needed for us all to grow. So I ask you, please stand with us as Connecticut residents to build a strong next generation so that they can be even stronger than me and even stronger than you. Thank you all for your time.
Thank you.
Good to see you.
Oh, can I answer one more question? I'm sorry. I know I wasted my time. But Senator,
Wait a minute. Somebody has a question for
Oh,
you.
okay.
Representative Reyes.
Thank you, Madam Chair. Mr. Amari, always good to see you. Thank you for advocating for the least of us. My question for you is, I know you have a lot of data. You and I have talked often on meals, school education, lack of meals. Is there any, in your information gathering, is there any one area, one school, anybody doing it better than anybody else? Do you know anybody who's doing it the best job in Connecticut?
based on the information, I can't say that there's anyone doing it better. There's no one size fits all for many different districts. It comes down to the area, right? Some districts are serving more locally grown foods, and so we could say that's an aspect that they're doing it better.
Mm-hmm.
Some are having schools that are operating on higher meal rates that have to produce 2,000 meals. Some have to produce 300 meals. So there's no necessarily way that says one is doing it better. Later, you're going to have a food service director that might be better able to answer that question from the School Nutrition Association, but there's no way to do that. But if I can say one thing, right? One factor is that earlier this year, we went to New Milford, Connecticut, a school district which I only know them for movies, but they talked about there how they were serving meals at a higher quality to try to make sure that they were meals that come from their community, and I think that's something that did it, but they couldn't afford that because there are programs like this. So I'd say people that are making that edge to understand what students want to see in their meals and culturally represent diverse meals are doing it better than others, but it's just unaffordable.
Well, Mr. Amari, thank you very much. That's a good way of phrasing that answer because it's quality, not quantity, and I get that response. And honestly, I know that Waterbury is not doing its best service because I hear a lot of complaints, and so I will continue this conversation with you offline. But we can do better as a state. I appreciate your testimony here this morning.
Thank you. We need you to cook for us, Rep. Reyes.
Thank you, sir.
Anybody else? Thank you. You're all set.
Thank you.
Up next is Jelani Ustani. Is Jelani here? No? Kelly Fitzgerald.
Good morning, everybody. Thank you, members of the Appropriations Committee. My name is Kelly Fitzgerald. I'm a resident of Cheshire and here today to speak in support of HB 5202 to allocate funding for Continuum of Care's emergency housing program. Today, I'm wearing my hat as the backbone to the Regional Coordinated Access Network for Greater New Haven. And in this role, we're responsible for understanding the need and coordinating available services that respond to households in a housing crisis. For years, we've had two gaps in addition to others, but one is that we've just not had enough shelter for the number of people who are seeking services. Today, we have 500 people on our shelter wait list in Greater New Haven. So today, if there was a place for them, they would be inside a shelter. The second is that the shelter model hasn't always been able to meet the needs of people who are unsheltered with complex needs. And so one of the things that we can look back from the pandemic and say was a benefit was being able to access non-congregate locations and being able to then implement long-term models for emergency shelter that are trauma-informed and the first of its kind in our state. And so being able to open the continuum of care shelter at Foxen and being able to serve 100 people on average every night, this has made a huge difference to our community. I have seen firsthand, I have made the phone calls to people to offer them shelter who otherwise have refused every other shelter, who have been outside for years, but for many reasons, whether it's PTSD, having pets, significant others that they are afraid to leave. People have been willing to come inside because of this shelter who otherwise have not been. And so this has been a truly meaningful resource to our community and to the people who have been able to access it. We've also seen that 64% of those that have been within this specific shelter have co-occurring disorders. And so while the Foxen shelter provides a place for people to come inside, it's also giving them a place to access safe and free health care instead of using the emergency room. So from our perspective, we truly cannot lose this shelter within our region. We cannot send 100 people outside this summer when ARPA funding runs out. And I asked the Appropriations Committee to really consider being able to fit this into our state budget. If I have 10 more seconds, I will just say that I also am in support of HB 5144 and truly believe that every child should have access to free and nutritious meals at school. My son in Cheshire consistently goes to get breakfast, and the fact that he's able to do that with the other students, with his classmates, is really important to me. And there shouldn't be a difference between who has to pay for it and who doesn't. So just wanted to put in another plug on that.
Thank you.
Yeah.
Are there any comments or questions? Seeing none, you're all set. I'm sorry. It's the only thing dainty about me is my sneezes. Up next is Taraza Kemp. Taraza, you're online, I believe.
Yes, good morning.
Okay, the floor is yours.
Thank you so much. Good morning, co-chairs and distinguished members of the Appropriations Committee. My name is Tirza Kemp, and I serve as the Director for the Department of Community Resilience for the City of New Haven, and I'm testifying in strong support of HB 5202, an act concerning funding for emergency housing. Emergency housing is a critical stabilization tool within our local crisis response systems. In New Haven, we continue to see individuals and families from across the region, many of whom are working, elderly, or caring for children, fall into homelessness due to rising rents, stagnant wages, and domestic violence, sudden job loss, or medical crisis. When emergency housing resources are underfunded, the result is not simply inconvenience, it is unsheltered, homelessness, overcrowded shelters, and prolonged instability that increases exposure to trauma, health complications, and victimization. HB 5202 directly addresses this gap by ensuring sustainable funding for emergency housing programs, including those operated by Continuum of Care. Continuum of Care is a longstanding, mission-driven provider serving individuals and families experiencing homelessness across our region. The emergency housing program at 270 Foxen offers immediate placement, case management, and coordinated pathways to permanent housing. They work with individuals with complex behavioral health needs, survivors of trauma, and people at risk of chronic homelessness, populations that require both housing and stabilization support. Investing in Continuum of Care's emergency housing program ensures that New Haven is a regional partner and its regional partners have a reliable partner capable of delivering rapid, trauma-informed interventions. Adequate house funding allows providers to respond in real time, placing individuals and families into safe, temporary accommodations, preventing shelter overflow, and connecting residents to income supports, healthcare, and long-term housing solutions. This bill has implications beyond housing alone. Emergency housing stabilizes children so they can remain in school. It supports survivors of domestic violence seeking safety. It provides a bridge for individuals reentering the community from incarceration. If HB 5202 passes, we can shift from reactive crisis management to proactive stabilization. Imagine a system in which no family in New Haven sleeps in a car while waiting for shelter space, where a survivor of violence can access immediate safe placement, where an individual behavioral health needs receives both housing and coordinated support instead of cycling between the streets and emergency rooms. Emergency housing is not a discretionary expense. And I'll leave it there. Thank you.
Thank you, Ms. Kemp. It's good to see you again. I'm glad.
You as well, Representative Walker. Great to see you, and thank you for your time.
Come on up to Hartford. Anyhow, thank you for your testimony. Are there any questions or comments? If not,
Yes,
thank
Rick
you.
Walker, I had a question.
All right, go right ahead. Who is this? Oh, hi,
Representative
Tina.
Corpus.
State
Go
Rep
ahead,
Tina
Tina.
Corpus.
Go right ahead, Representative.
Thank you very much for your testimony. I think you may be the third person who's talked about our homelessness issue here in the state. And I don't know if your particular shelter received COVID funding, but we've heard this morning that there's going to be a COVID cliff on July 1st, that COVID funding for this problem is running out. We've also heard that about 40% of people, at least one witness said, have never before been homeless and are now homeless. So I'm just curious what is going on because, you know, ARPA was about 17 or 18 times the size of the Marshall Plan, which bailed out the entire European continent after World War II. So we're talking about a massive amount of money that, and Connecticut got our share of that. So are we really saying that we have developed such a homelessness problem in Connecticut that now, even after COVID is over, we have all the COVID homelessness problems that we had for all the COVID reasons, plus more?
Okay, I just want.
And if so,
Representative,
what do
I
you
just want to
attribute that to?
Representative, I just want to remind everybody, we're not talking about COVID dollars here. We're talking about general fund dollars. So I just want to make sure this is we have to be very specific about the dollars that we're talking about today. But I will let Ms. Kemp give an answer, but just make sure that we're talking about the funding budget. Okay.
Yes, I'm asking about the dollars that we're appropriating in this bill because what I'm asking, what I'm asking is how is the problem so big, and what factors are at play? Thank you.
Okay, go ahead. Go ahead.
Thank you very much, and thank you for lifting this because yes, we are experiencing this in New Haven where the ARPA cliff it's ending and organizations are impacted, and which means that people are impacted. And I believe that from my experience I oversee the Office of Housing and Homeless Services here in New Haven, and people are becoming worse off. I think Jim Ferralis testified earlier about our elderly population. Our numbers are increasing. Kelly Fitzgerald from the CAN United Way also listed the same thing. Families from high rent, wages are not increasing. Unfortunately, it is impacting our families, and our homeless population is increasing, and we need help. We need help for sustainable resources for our population to be able to ensure they are housed and stabilized.
Can I ask a question in this? Is this, or do you think that this is directly related just to COVID, or do you think that it's because we are not getting enough funding from Washington?
I believe it's because we're not getting enough funding from Washington. I think COVID exacerbated the situation, but it's about the funding from Washington. And this is a national epidemic at this point. This
And
is
that's
not just a New Haven issue. This is not just a Connecticut issue, but it is a national issue. And so thank you for lifting that, Representative Walker. I think COVID just exacerbated the situation.
It did it on a lot of issues, but what's unfortunately happening is that we have hidden behind other entities, but we need to talk about what are the funds that we're getting back from Washington to do the things that we pay our taxes down to Washington for. And I think that is where we have to figure out what are we going to do going forward as Washington sort of spins around right now, not addressing the needs of the states locally. So thank you. Thank you.
Thank you. I wholeheartedly agree. Thank you.
Okay, thank you. Are there any other questions? Yes.
Thank you so much for being here today. We really appreciate it. I actually sat in on 2 separate hearings yesterday that talked about homelessness. And so I think I just want to get a better understanding from you because you are really on the front lines. The challenges in terms of why people are homeless now and why we're asking for this funding now or looking at this funding now. What are you hearing from people when they are coming into shelter? What is it that they are saying the reason is why they are now in shelter, or if they are staying in shelter and not maybe turning over to housing as fast, what is the reason for that?
The reasons are extremely complex. And so it is not just one reason. It could be mental health. It could be an elderly person who is on an income, a fixed income. The landlord raises the rent. They're unable to continue to pay that rent. If there's mental health, there's substance use, the reentry, those who have past criminal convictions, finding a hard time obtaining employment, lack of income, underemployed, undereducated. The issues are very, very complex. And so an individual who comes in at one time was stabilized, unfortunately, for a number of reasons, they lost their housing. But it's extremely complex.
Yeah, no, I appreciate that because I think that a lot of times with some of these issues, we try to boil them down to, oh, there just wasn't enough money for this, or there wasn't enough, and it's not, we heard a lot yesterday about evictions and a lot about people being evicted because a disabled person that could be evicted and then the next person pays $300 more. And so when we think about the continuum of care and the money that's been lost there, those are our most medically fragile, elderly, and disabled. So thank you very much for expanding on that.
Thank you very much.
Thank you. Representative McCarthy-Vahey.
Thank you so much, Madam Chair. And Ms. Kemp, thank you for being here and for the work that you are doing. I recently learned that Connecticut, Data Haven shared data, that Connecticut has the lowest number of per capita real estate listings on the market in the nation. And that from 2017 to 2023, we were 49th out of 50th in states, and this is Pew Charitable Trust data, in number of building permits issued. So what I am wondering is, in addition to the conversation you've had with the other members, are you seeing supply and basically the lack of different types of housing available as being a bigger issue now and impacting people more now than you have in the past?
Short answer, yes, 100%. And so when we think about the lack of housing stock, the lack of supportive housing, the lack of deeply affordable housing, so affordable can be different for many individuals depending on what they can afford. And so now we're in this layering from affordable to deeply affordable, especially for our elderly population, especially for our disabled population. And there's just a lack of housing stock. And trying to engage landlords outside of New Haven to be able to work with individuals and their incomes to provide that housing has become quite difficult.
Thank you. And it was pointed out to me recently that if someone who can afford affordable housing, they can choose between affordable and deeply affordable, and they may choose deeply affordable, so they have, more options for other bills they might need to pay, whereas someone who needs deeply affordable can only choose deeply affordable, and they're being knocked out by others who may have other resources as well. So I really appreciate you sharing this and advocating on behalf of the people who are struggling with this issue. Thank you, Madam Chair.
Thank you. Representative Dillon.
Thank you very much, Madam Chair. And thank you very much for your testimony and for the work that you do, Ms. Kemp. Um, and it seems to me that we had a problem just looking within the 92nd district, which is, not all of the city, that there were units on the boulevard that were maintained, that were owned by a private owner that had Demas clients, and he wanted to put it on the market, and we had to intervene and rescue that. And I think that was the Continuum of Care project, was it not?
I'm not familiar with that project.
Okay, there are some older little white units that have been there for a long time, facing the West River Park. And it just seems to me that, and it may be very similar from what the public health chair said, that we have a tremendous amount of pressure on inventory and a lot of towns that won't allow this use at all. So that there was one time period where we were facing 100 people who with behavioral issues who had long-term tenants in these many units who were facing eviction because the private owner wanted to sell. And we also had people who were occupying the West River Park, where the children from the Hill and West River used to play soccer. Because they said, I don't think they were from New Haven. I went down and met a lot of them. And they said, it was kind of a statement they were making, but they were also competing for use too, because children used to play there and they were there. And so there is an inventory issue. Would you agree? And then there's also a land use issue in terms of what areas will allow certain uses. And I believe that urban children should have the ability to have free play. And the density has its limits because there now you have to go like I think about 8 miles from our side of the city to the East Shore to play soccer. And there's something that we're losing in the experience of children. That's another land use, not the same as what you're talking about. So I just wanted to raise the issue of competing uses for inventory and lack of inventory.
You are correct. You are absolutely correct. Actually, you are referencing Ella Blake. That was the building that you're referencing over off the boulevard. And you are absolutely right. There is not enough housing stock. I think the other thing is New Haven is so rich in resources. And so a lot of times when these services are not offered in some of our more rural areas of Connecticut, people do come to New Haven to be able to get the resources that they may be looking for and the services that they're looking for. And there is a bottleneck right now. And unfortunately, we don't have the housing stock. And we love serving the community. We want people to come to New Haven and find the services that they're looking for. But we need developers to be thinking about those deeply affordable projects. We need individuals, and we need the funding. We need the funding. We need the funding. We need the funding from the government, and we need the funding from the state of Connecticut to be able to find these buildings and turn them into supportive housing.
I appreciate that and your work. Thank you.
Thank you very much. Thank you, everybody.
Thank you so much. Thank you all.
Have a good day, and we definitely are going to address housing. Thank
you so much. Thank you so much.
Up next is Aisha Thompson. Is Aisha Thompson here? Up next is Benjamin Galarza. Is Benjamin Galarza here? Okay, the floor is yours, Benjamin.
Come on up.
Who is Benjamin Galarza? Somebody you're helping?
Yes.
Thank you. Is Aisha Thompson the other person right there? Okay, you'll be up next. Okay? Benjamin Galarza, the floor is yours.
Good morning, Senator Austin, Representative Walker.
He has to turn on his mic. Thank you.
Good morning.
There you go, sir.
Good morning, Senator Austin, Representative Walker, Senator Summers, Representative Nucio, and honorable members of the Appropriations Committee. My name is Benjamin Galarza, and I am resident of Continuum of Care Emergency Housing Program. I'm here this morning to urge you to fund HA 5202 to sustain the emergency housing program currently funded by American Rescue Plan Act ARPA funds. They are due to expire in June 2026. I've been homeless for almost 2 years now, and this program has helped me stay sober, stay in a safe place. I'm in the process of obtaining a Section 8 voucher, which has been very difficult to obtain, and I want to get ahead and do right, and this program is very good. Without that program, I'll be homeless on the street, and I have mental illness. I'm in treatment for drug addiction. I've been doing good for the last 15 years. I've been not using any type of drugs. I've been doing great, but it's important for myself to have a safe place and to live with my mental illness and my substance abuse, which it's impossible being homeless. But this program is a very good program, and they have helped me a lot.
Thank you, Benjamin. Appreciate it. Are you staying up here to help out other people too? Thank you. Aisha Thompson.
Good morning, Senator and representatives of the Appropriations Committee. My name is Lashaya Thompson, and I am a resident of Continuum Care Emergency Housing Program. I am here this morning to urge you to fund HB 5202 to sustain the emergency housing program currently funded by American Rescue Plan Act ARPA funds that are due to expire June 2026. I'm currently from Waterbury, Connecticut. I came to New Haven about June to be 2 years. I came to New Haven to go into drug treatment, and in the midst of that, I was still, after the drug treatment, I was going to remain homeless until I came into this program. Being in this program for the last year has helped me tremendously. Everything that I set my goals out to be, I accomplished. Getting my ID, my birth certificate, my social security card. I also got my Section 8 voucher, and the staff there helped me tremendously with everything. And I mean, being in this program basically helped me not to be on the street, and that program needs to be able to help other people. There's a lot of people out there that doesn't have anywhere to go, and I've seen this program actually open up a warming center for these people, fed them, and done other things. They're not just there to, give us housing. They're there also to, help us with other things like, work, stuff like that. Just not housing. They help with a lot of other things, and I think that it's a great program, and I also think that it needs to stay open for those that come behind me and, other people. It was a good program to me. I accomplished a lot by being here.
Thank you.
I like it.
Thank you.
You're welcome.
Do you have any other members that are speaking today, sir? Okay. Do you want to, I don't know, which ones are they?
Teresa Keneally.
Go ahead.
Colin Marusa.
Teresa, come on up.
Jason Hawkins.
Okay.
Hi, good morning. Senator Austin, Representative Walker, Senator Summers, Representative Nucio, and honorable members of the Appropriations Committee. My name is Teresa Keneally, and I am a resident of Continuum of Care Emergency Housing Program. I am here this morning to urge you to find HB 502 to sustain the emergency housing program currently funded by American Rescue Plan Act, ARPA, funds that are due to expire in June 2026. My story is a little different. I am the one with my son. I was living in Washington Avenue in West Haven, 191. We had a flood. We rented. We did not own the house. We had a flood. And the old owners sold it to some brokers that came from New York that were kicking out people through COVID that did pay their rent. And we were one of those families. So with that said, we ended up in the street by Quinnipiac Avenue, sleeping in a tent. And next thing you know, we were in abandoned houses. It's been 2 years. Finally, I met somebody, and 211 called me and went through the process, and we are now at continuum of care. If it wasn't for them, I would be dead. I am a cancer survivor. I have no thyroid, and my son is only 35. He just turned 35. We both were working people, and we can't find a landlord, like you said. In the meantime, we had got a notice of eviction, and I didn't understand why. And now I'm finding it hard to get it modified and overturned at New Haven Housing. They're not understanding the situation. We did not own the house, and I never got we never got our security deposit back or anything. So we've been at continuum care for almost a year. We're in the process of looking for an apartment, trying to go through housing, but we may have to go through a private landlord, which is going to be very difficult without the eviction being modified. Our civil rights were violated. It was an illegal and unjust vacate. I've been trying to prove that for 2 years. I have spoken to Senator Looney and Rosa DeLaura's office. I've been working diligently. I went to the 360 forum. So far, I have not gotten anywhere. The program does a lot. They feed us, like Ms. Shea said. They not only do that, they help us find work. They help us find apartments. They do case management. It's not just for housing. With that said, if there's any landlords or any lawyers out there that would like to take our case, I would greatly appreciate it. I guess, thank you. And with that said, sorry. Sorry, my phone's not working right. I had something to say. I need this one. Okay. I wanted to start by saying thank you to the staff at Continuum of Care. They have treated me with respect, kindness during this difficult time in my life. Being here has helped me feel safe and stable. Like I said, I would be dead, and I don't know what would have happened to my son. When you are trying to rebuild your life, civility is very important. Having a safe place to sleep and people who support you makes a big difference when you are trying to rebuild your lives. Stability is very important, and having a safe place to sleep. Oh, it's repeating it. Sorry. All the differences hearing that shelter may not be funded is very scary and terrifying for many of us. Like the other people said, it's not only us there, it's for people who are still out there and who need to come behind us as we become successful, if possible. We're doing the best we could do, move forward. We wouldn't be able to do it without this program and the staff who help us and support us in our goals to better our lives and restabilize ourselves. Without it, many people would not only lose their stability, but their sense of security, which would only break them down discourage them to continue fighting for good, fighting for improvement for their lives. I hope you will think about the people who live there now and to come, much this place means to us, and how this will ultimately affect us in our futures. Thank you for your time and listening.
Thank you. And who do you have next, sir? Is there anybody else?
Good morning, senators, representatives, and all the members of the committee. My name is Jason Hawkins, and I urge you to fund this bill, HB 202. I'm currently a resident of the Emergency Housing Program in New Haven. I've been there since June of 2025, and I got to say, it's been a long road. It's been a very long road for me. I don't want to get emotional about this, but it's going to be tough. I'm an addict. In 2022, I was arrested for a DWI. I went to jail, and with that, I lost everything. Lost my house, or lost where I was living. Lost my car, I lost all my possessions. I even lost friends and family because of this. I did everything I could to stay off the street. Went to hospitals. I went to rehab centers, shelters, and I was even on the street. And it wasn't until I found the emergency housing program through 211, I did a CAN assessment, and they took me in. I've been there for a year now, and I gotta say, they've been absolutely fantastic. These people are just amazing, amazing. Through them, I've got a case manager, I've got an APRN, I've got a nurse, and I've got a therapist, all of which I see every week, and I'm working to maintain my sobriety. They're helping me with housing, which I'm soon to get. Should be a few weeks now. I'm going to have my own apartment again. They even saved my life. About a month ago, I had a cardiac event, and I collapsed. And if it wasn't for them, nobody would have found me. I would have died. They dialed 911. I spent 2 weeks at Yale. They put a pacemaker in, and I'm happy to say I'm back to health now. So they've literally and figuratively saved my life. You know, the biggest thing I want to say is there's a big stigma against the homeless. And the part of my story that I haven't mentioned yet is about 10 years ago, I was a broadcaster. I worked for NBC Connecticut. I was a reporter. So I was out on the street every day reporting on stories just like this. I was on television every day. I was in these rooms reporting. And to fall this far is something I never would have imagined. And if it wasn't for the emergency housing program, I don't know where I'd be. I'd probably be dead. So to all of you, please think about this bill, and please think about the people like everybody you've heard and all the people that you don't see, because they're the ones that are really suffering. So
Thank you.
Thank you.
Appreciate it. Can you introduce yourself too, please, so that we know who is yes?
My name is
Not
Jason
you.
Hawkins.
I got you, Jason.
Yeah.
The gentleman sitting next to you.
Yeah, my name is John Lebenick. I'm here covering for Wanda Joffrey. I
Oh.
oversee the program.
Okay, and do you have anything to say, sir?
Yes, I do.
Okay, you might as well go next so that we can finish up your whole group.
Thanks, I appreciate it. Good morning, Senators and the Appropriation Committee. My name is John Lebenick. I am a staff member for Continuum of Care, overseeing the Emergency Housing Program at 270 Foxen. I'm testifying in support of the Bill 5202. I care deeply about this issue this issue because of the individuals that spoke and the many more that are living there who could be on the streets as of June 30th without support. Right now, today in our program, 45% of the individuals there are 55 and have medical complications. 56% have co-occurring mental health and substance use conditions. I'm here as the Vice President of Emergency and Acute Services, as well as a licensed clinical social worker specializing in homeless services. I am also somebody with my own story. I have lived this life and faced addiction, trauma, and homelessness in my youth. I know very well the isolation, the loneliness that paralyzes you day to day. I believe homelessness can be defeated when you have the right place, the right team, and the right mission to circle around you and lift you up when you cannot lift yourself. Continuum's program offers all of this, along with a very special environment that provides people with the privacy, dignity, and respect that they deserve. I was homeless here in Hartford. I lived on the shelters, and at my last day of being homeless, I slept here in Bushnell Park because I was afraid to go to those congregate shelters because of what happened to me. The shelter is not just a shelter, it's a sanctuary and a family for those with nothing but the very clothes on their back sometimes. If my mother were alive today, she would be here before you shouting that I am living proof that recovery is possible. Years ago, a team invested in me, and today I'm asking you to do the same for others. Unhoused individuals have become lepers of our society. They're unseen, forgotten, and burdened by relentless shame that shadows you every single day when a door is closed. I lived that reality, and I plea that we cannot close the doors on Foxen. Our most vulnerable neighbors, our own grandmothers, brothers, and sisters are suffering through complexities of trauma, mental illness, and medical disabilities. Foxen is the only game in town. It's the only hotel turned shelter in Greater New Haven that provides robust clinical services in a safe, low-barrier setting that allows people to recover and to move forward. Greater New Haven's unhoused population is not just growing, it's aging and becoming sicker. Continuum Shelter on the Boulevard has served as a vital haven and the only place that can accommodate folks with such complex conditions, aging, battling cancer, utilizing wheelchairs and walkers, and facing terminal illnesses. We cannot afford to look away. If we continue to ignore the crisis, it will only get worse. We appreciate the governor has secured some investments in homelessness and housing stability. Those dollars matter, but they don't meet the need and the urgency that we're facing here in Greater New Haven. I respectfully urge the committee to support Bill 5202 so that funding can be used to preserve a proven and critical resource that will protect the humanity and the well-being of some of our most vulnerable citizens. Please invest in your community. Without funding, 100 individuals, some of whom are seniors and medically compromised adults, will be on the streets. And what a horrific place to live. And as mentioned, with the cold weather, we've had people die out on the streets. I thank you for considering my testimony.
Thank you, sir. Don't go anywhere because Representative Ackert had a question before, and I don't know if it fits into your, no, you're all set then.
Thank you.
Thank you. Are there any other comments or questions? Seeing none, thank you very much. Appreciate you. We're going to go back to number 8, who is now here. Oh, no, I thought everybody testified. Go ahead, Colin, and then I'll come back to you, Joe. Colin.
Marusa.
Okay, go ahead. I thought we had gotten everybody, that's why.
That's okay, no problem. Good morning, honorable members of the Appropriation and Committee. When I was homeless for probably over 3 years, and I came to Continuum. And as far as me being there with the committee and everything, with the help of staff members and stuff like that, that they helped me a tremendous amount. Got my head screwed back on straight, and they're pointing me in the right direction. I'm in the process of also looking for an apartment myself. And it's, right now it's just hard because of the way, no funding, the funding has to come in, and I would respect as far as things, as far as funding, and other people, like John also said, are dying out there and they're suffering. I was in Milford, and I slept on a concrete slab in the cold and froze. And that wasn't fun. There were some nights when I had my vehicle, I slept in there, and it was still cold. And I think by funding this program, it would be basic honor to all of us and all the individuals that are still out there as far as that need help. I think that it's more of a helping situation as far as to people that are, still out there, they're freezing, they're hungry, and they're suffering as well. And they're not getting the help that they need. I really think they need the help that they need instead of suffering. Because suffering, suffering is just, I see deaths all the time because I am an EMT for over 5 years. And I see it all the time. And you know what? It doesn't make me happy at all to see somebody die. Okay? And it really is a common thing that's been happening for people freezing. And it's not very good because there's a lot of people out there that suffered this winter, suffered in the cold, got frostbite, and they probably most likely passed away. I myself was in the hospital twice. I was in the hospital with an infection in my foot, and then I couldn't breathe. And I was there for approximately probably 8 days. And they said everything was clear on me. But I could have basically also had a heart attack, in my sleep, and that never happened. So I'm doing 10 times better. I have over 24 years clean and sober, and I'm still going, and I'm still fighting. As much as the medical issues that I have, it's painful, but it's also very hard to control certain things. And it's not something I want to deal with the rest of my life.
Thank you.
Thank you.
We have two more.
Okay.
They really had the courage to come out here.
I understand. I'm trying to get us back on track, but go ahead. Who's next? And their names? I'll hear it up there. I can't hear all the way up there. Go ahead, sir. And one more after this? Okay.
Yes.
Thank you.
And if you could identify yourself, please.
Hello, Senator Austin.
Yep, that's me.
Representatives and all that.
There's a bunch of us here.
Yeah. Not sure how to address everybody. but
You don't have to. We're not that important.
Well, my name is Malik Shah.
Malik Shah.
Yes, and I'm part of the Continuum of Care Emergency Housing Program. I've been there for about 7 months now, and I want to say that they have been a real big help for me. Remarkable. They provide food, they provide a place to sleep. I've been able to go back to work. I've been able to go back to school. I've been able to get my health back in track, go to my appointments, schedule my appointments, case management support. So that's why I really believe that you guys should really fund, the program. I think it's a great program. It helps a lot of people, and You know, it's one of the best places I've been to as far as homeless shelters, as you know. So,
Can you spell your last name, please?
Shah, S-H-A-H.
S-A-A-H.
No, S-H-A-H.
S-H-A-H.
Yes.
Got
Shah.
it.
Yep.
Thank you.
Yep.
Thank you so much. And who do you have up next, sir? She's all set? All right. Thank you very much. Appreciate you. Yep. Up next is Joe Almond. Joe? What?
I'd like to say something.
Say, I'm sorry, I didn't hear what you said.
I'd like to speak to the group.
To the group? Go ahead.
Yeah. Thank you, Madam Chair. So,
Joe, go wait over there.
to all the, no, you say you come up.
No,
To all those associates that came here and speak, I'm very proud of you, and I see your courage in coming here to speak, and I can feel your pain. I had a younger sister that was in the similar boat to you folks right now, and just wanted to let you know that there are people on both sides of the aisle that care about you, and that you are not alone in this. And I want to thank the agencies that are supporting you, and we hear you loud and clear. And as I said, every family can experience this. My youngest sister went through this very same steps. So God bless you all. Thank you. Thank you, Madam Chair.
Okay. I'm not certain if we're there yet, Joe, but go ahead and take a stab for it.
Okay.
She's number 8, just so you all know.
Is that it? Okay.
Go ahead.
Okay. So, honorable members of the Appropriations Committee, I'm a current college freshman at Wesleyan University, and I was also the beneficiary of a free school meals program all throughout high school. And so I'm here today to urge you to support HB 5144, which is an act concerning school meals, so that kids in Connecticut can benefit from this deeply needed program, just like kids in my community back home did. So I'm from Arlington, Massachusetts, outside of Boston, and in high school, I became involved in efforts to pass a constitutional amendment in Massachusetts called the Fair Share Amendment. I remember holding signs outside of train stations and canvassing my town in order to gain the votes necessary. And luckily, this amendment passed. So now Massachusetts taxes 4% on incomes over $1 million. And one of the first initiatives funded by the Fair Share Amendment was universal free school meals, breakfast and lunch, from grades kindergarten through 12. And so in my high school, free school meals were incredibly helpful and really popular for myself and my peers. My public high school offered fresh fruits and vegetables every day, and even partnered with local farms and advertised their sourcing for students. And so even as a vegetarian, I could always count on getting a full, nourishing meal totally for free. And I was a very busy high schooler, and I also struggled at times with disordered eating. And so consistent food access during the school day without a barrier of cost was invaluable in reducing my anxiety around food and allowing me to focus more on my studies. And I want kids in Connecticut to be able to benefit from a similar program, just like the program that I witnessed have such positive results in my own community. In Connecticut, there's no doubt that there's a need for free school meals. The statistics speak for themselves. 14 to 16% of people in the state are food insecure, including 1 in 6 children. This is a staggeringly large proportion, even without considering that many children who aren't officially food insecure would still benefit hugely from free school meals. And this isn't just a conjecture. 46,000 children in the state are eligible for reduced price meals because they just barely clear the current threshold for free meals. Free school meals also reduce stigma and anxiety around lunch payment and debts. I remember personally and very vividly my feelings of shame and fear in elementary school before school meals were free in Massachusetts, when my lunch account would run out of money and I'd be told that I had to pay back the school for my Friday slice of pizza. And I was barely old enough to even understand what money meant. And all I knew was that suddenly someone was telling me that I somehow didn't deserve the food that I was eating. I think no kid should feel like they have to earn their nourishment. It should be taught from a young age that nourishing food is a right and not a privilege, just like education. And the only way to demonstrate this is through free meals for everyone. The food that nourished me throughout my childhood gave me the energy to get to where I am today, which is a Wesleyan University student planning to major in environmental studies and proud to work for Rooted Solidarity, the food justice project out of our College of the Environment. Through Rooted Solidarity, I've learned more about the crucial challenges facing Connecticut families, especially around food access. I believe passionately that a thriving community requires nourishing food accessible to all, and HB 5144 is your chance as legislators to fuel the minds and bodies of Connecticut's newest generation. I urge you to invest in nourishment above all else, because it is from the food that we eat that we gain the capacity to create, to grow, to learn, and to become. And no one, especially our youngest, should be excluded from that. Thank you so much for your time, and I urge you once again to pass HB 5144 and act concerning school meals.
Thank you. Representative Ackert?
Thank you, Madam Chair, and thank you for being here. So it really worked, because here you're at Wesleyan, so that's pretty impressive. You mentioned the 4% tax over $1 million. Was it specifically targeted for that, or was it just an overall tax to go into the general fund?
It wasn't specifically intended necessarily to go to free school meals, but that ended up like being one of the programs that it funded.
Yeah. Okay. Thank you for that answer. Thank you, Madam Chair.
Representative Dathan has a quick question.
I'm just more of a comment. Thank you for talking about how this bill could potentially help those that suffer from disordered eating. I think that's something that people don't talk about. My daughter suffers from it, and I know that having people around you, your peers, all eating at the same time really takes away that stigma, and I think that's a good sort of side effect. And so I'm proud that you talked about that and what it meant for you as a young person. So thank you so much. Thank you, Madam Chair.
Thank you.
Anybody else? Seeing no one? You're all set?
Thanks so
for coming.
much.
Is Jelani Ustani here? No. Haley Simpson, are you here? Haley?
Yes, I am here.
Okay, go ahead.
Thank you. Good morning, co-chairs, Senator Alston and Representative Walker, ranking members Summers and Nuccio, and members of the Appropriation Committee. My name is Haley Simpson, and I serve as the Director of Transportation, Traffic, and Parking for the City of New Haven. I'm submitting testimony in strong support of HB 5172, which would provide funding for the installation and maintenance of radar speed feedback signs on Forest Road here in the City of New Haven. Forest Road is a local connector that connects residential neighborhoods and local towns, cities, municipalities, parks, and nearby destinations. It carries meaningful daily traffic. Average annual daily traffic is approximately 12,000 vehicles, with peak hour volumes around 1,200 vehicles. That combination of function and value means that speed management is not a nice to have, it is a basic safety infrastructure. Recent crash history underscores the need for a focused corridor-based response. Between January 1st, 2023 and February 2026, 71 crashes were reported along Forest Road. Most crashes involved collisions between motor vehicles and a share involved vehicles striking fixed roadside objects such as utility poles and trees. These patterns reinforce the need for speed management and driver awareness on a corridor that functions as both a neighborhood street and a daily travel route. Radar speed feedback signs are a practical tool that addresses this problem directly. They provide real-time speed information. They reinforce the posted limit. They prompt self-correction without requiring a traffic stop. They also help set expectations for safer driving on a neighborhood street. This bill would allow Department of Transportation to install radar speed feedback signs at targeted locations along Forest Road. and to keep them operational over time. That maintenance component matters. If the state funds installation but not upkeep, devices can quickly fall out of service. House Bill 5172 recognizes that effective safety countermeasures require both deployment and durability. Passing House Bill 5172 can produce a visible change residents can feel. Drivers will receive immediate feedback, speeds will become more consistent, the corridor will be safer for people accessing parks, homes, and nearby destinations. It will also complement the city's broader roadway safety work by adding a practical, scalable countermeasure that can be replicated where similar community concerns exist. For these reasons, I respectfully urge the committee to advance House Bill 5172 and support funding for radar speed feedback signs on Forest Road. Thank you.
Thank you. Are there any comments or questions? Representative Reyes.
Thank you, Madam Chair. Couldn't agree more with the testimony. I'm very familiar with the road in New Haven, and it's typically these side roads that eventually become main throughways for, especially in growing inner cities. And I looked at this bill, and I actually am thinking to myself of several paths, several cut-throughs, roads in the city of Waterbury that would probably fit the bill as well. So I applaud you for your testimony and your advocacy on this important bill. Thank you, Madam Chair.
That's under there in the cart.
Thank you. Thank you. Anybody else? Seeing,
Yes.
online, Representative Kennedy?
Thank you, Madam Chair. I think our Representative Dillon might have been before me. You want me to go first or let her go? Okay, thank you. Yep, just a quick question then. Your statistics that you mentioned, did that take into consideration Hopkins School is located right on Forest Road with in excess of 700 students that attend there, plus an additional 150 approximately faculty. So I was just wondering if the numbers that you cited in your testimony took into consideration Hopkins School, because I know in the morning hours, I know that area very well, and that does contribute to some of the traffic in that line, in that area, excuse me.
Thank you so much for your question. So we did not focus specifically on Hopkins School, but if you would like for us to, we can provide you with more granular details on like that specific hour between drop off and pickup for that school and how that contributes to the overall data. But we were just looking at very basic daily commute between Monday through Sunday. But we can absolutely provide that to you if you would like.
I appreciate that. Thank you. I really
Yep,
think
no
it would be
problem.
something to take into consideration because that certainly does add to the congestion on that road. Thank you, Madam Chair.
Absolutely.
Representative Dillon.
Thank you very much, Madam Chair. And thank you, Ms. Simpson, for taking the time to appear in person. It really means a lot. I mean, this issue, as you know, there's a problem on Forest Road with flooding that we actually allocated dollars for a few years ago, and I'm hoping that that project goes forward. The combination of the flooding and the speeding on the whole throughway from West Haven to Fountain Road Fountain Street has terrified a lot of the homeowners, and the elected officials contacted us and said that, you know, the city kept saying it's a state issue, but they're terrified that we're 1 nanosecond away from a really bad accident. I think the cost of this would be pretty low, wouldn't it? I mean, I looked at the when Senator Winfield and I were approached, I looked at the cost of these devices, and they're not that great, are they?
I'm sorry, I just want to make sure I'm answering your question
The
accurately. Are you asking
expensive,
about if it's that expensive?
right?
You know, I want to be very careful how I answer that because it can be inexpensive today and then extremely expensive tomorrow.
Right.
So I guess it all depends in the point in time that you order it. But what we always want to keep in consideration is the maintenance, right? That can also play a part in terms of how much we're budgeting for it. how much we anticipate, the sign may lose a bulb or, lose service, et cetera, and what that can cost. So what we can do is we can try to come up with a cost estimate and provide that to you in terms of purchasing the equipment, installation, and just maintenance, with the caveat that it's just a point in time and, things can change.
Thank you. Yeah, after a death of a constituent who was pretty much standing in his driveway, there were a lot of different meetings and pictures of us standing out on the road. And some people wanted the road straightened out and met with some people from the DOT, and other people just went crazy and said, no, that's a historic scenic road. That's the road that the British marched down from West Haven down to the
Any
green.
other questions, Pat? Any other questions?
Thank you very much, Madam Chair. I just wanted to say that many remedies have been proposed, and I think this is the most affordable, and it means a lot that you're here and we're working together. Thank you very much.
Thank you.
Thank you.
Anybody else? Seeing nobody. Up next is Stephanie Deason. Stephanie?
Hello, I'm here. Can you hear me?
Yes, I can.
Thank you. Senator Austin, Representative Walker, Senator Summers, Representative Nucio, and members of the Appropriation Committee. My name is Stephanie Deason, and I am testifying today regarding House Bill 5144, an act concerning funding for school meals. I'm the food service director for Stonington Public Schools, a non-CEP, largely rural district, and I serve as the current year president of the School Nutrition Association of Connecticut, which represents food service directors, cafeteria workers, industry members, brokers, distributors, and manufacturers, and all other partners across the state. I'm a resident of Uncasville. I support universal, and I will clarify, I know a lot of testimony gets thrown around on whether we are in support of no-cost school breakfast or no-cost school meals as a whole, including lunch. I understand that's a huge ask, so this testimony is very much driven to ask for no-cost school breakfast back and covering the reduced portion of the cost for reduced price families to be able to eat meals for free. As we all know, Connecticut families are struggling. We have a large ALICE population, and the federal income guideline charts that dictate whether or not a family qualifies for free and reduced meals very much so does not apply to the high cost of living in the state of Connecticut. So getting school breakfast back and getting the reduced price households covered to eat for free would be a huge practical proven investment in both students and our state's future. In my district alone, when we lost universal free breakfast at the end of the state budget, the 23-24 school year, I saw a reduction in elementary school students eating breakfast from 30 to 40%, 55 to 70% reduction among middle school students, and a 40% reduction among high school students. That is a large amount of students that were no longer accessing breakfast at school. Whether they were getting it at home, I'm unsure of, but just not seeing those students come through our doors is concerning. With the reduction of program participation comes a reduction in program funding, which leads to operational meal programs on a budget that is unsustainable for providing higher quality, less processed meals. I know, Rep, you had mentioned in Waterbury, they weren't making the cut, and we can talk a little bit about that. We are a nonprofit. Every school food service operation is nonprofit, and we are expected to operate at a break-even point. When we are not operating at a break-even point, we have to ask for education to subsidize our programs. Without sustainable funding for the meals that we are serving, it is hard with rising labor costs, food costs, supply costs to operate at a break-even point. Universal free meals will help subside that ask to our boards of education. The other thing we see with losing free school breakfast is the increase in student meal debt. Student meal debt is not an allowable expense for school districts to cover under the food service budget. So that is now another ask I need to go to my business official for, on top of asking to subsidize our program if we're not operating at a break-even point. So funding free school meals or free school breakfast at the state level will reduce those two big financial asks to the already constrained budgets of our school systems in our towns. And obviously all the other benefits that come with, better student outputs, attendance, all that stuff. So I thank you all for the opportunity to submit today, and I definitely welcome questions. I'm not sure, Amari did a great job answering the question about, can we do better? Is it created equal? And it isn't, again, school district size and capability alone, anything from staffing structure to what we have in terms of equipment. If you're in a well-equipped kitchen and you only are serving 80 kids for breakfast, yes, of course, you're going to be able to do more local, more scratch cooking. But if you're in a big school and you're operating satellite kitchens or even grab and go stations and you're serving, 800 kids in a 10-minute period, you are going to see variation in what is served. But I think getting this funded is just so important. And really, again, the school breakfast program is not sustainably funded from the federal government as it is. And funding it at the state level is truly a stepping off point for us to be able to increase the quality in our programs.
Thank you. Representative Cavros DeGraw.
Just one quick question, and I may have missed it in your testimony. Do you know what your school lunch debt is currently?
I do. It is north of $25,000.
Okay, thank you, because we're hearing that a lot from a lot of districts about, the debt that they are incurring, asking the boards of ed to cover it, in terms of making sure kids are still getting fed.
And $25,000 is a salary of a paraprofessional. We all know that, the shortage and difficulty of getting those in the classroom already. So it is a big ask to the district that could be eliminated.
Yeah, I know, at least in Canton, I think it's $14,000 at last check that they were sitting at. So for a small town, $14,000 is a lot of money. Thank you so much.
Anybody else? Seeing none, you're all set. Thank you.
Thank you.
Up next is Tida Infasong, number 21.
Hi, can you hear me?
Yep, we can.
Great, thank you. So good afternoon, Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Tida Infasang. I'm the Senior Director of Advocacy and Partnerships at United Way, Coastal and Western Connecticut. I want to thank you for this opportunity to speak in support of House Bill 5144, an act concerning school meals. This bill is a very important first step in providing universal no-cost school meals, and it's a practical way to help families manage rising costs across the state. When we reduce daily expensive school meals, it directly supports households facing the high cost of housing, childcare, and groceries, while ensuring that children have reliable access to nutritious food, an essential foundation for learning and well-being. And at just 0.02% of the proposed state budget, this is a smart, efficient, and cost-effective investment that uses a proven system to reduce childhood hunger and strengthen family stability. Across our 27-town footprint in Fairfield and Southern Litchfield counties, we have 42% of households who are ALICE. That's more than 336,000 families that are ALICE and working but struggling to make ends meet. We know that during the pandemic, when meals were free for all students, participation surged, showing that families just above the income limit still need help. The income cap for a family of 4 for reduced price meals is under $58,000, while at the same time, to barely survive in Fairfield County, it's closer to $130,000. There's too many working families that fall into this gap. Universal no-cost school meals costs would save families roughly $1,000 per year per child. That reduces stigma and meal debt, improves attendance and performance, and as Stephanie mentioned, will help our local school districts. The need is really important and really urgent right now. We know that 14 to 16% of households are food insecure. That's a 40% increase since 2020, making Connecticut the most food insecure state in New England. In 2025, 26% of households with kids experience food insecurity, and when you go into urban communities, that number nearly doubles. So when we provide consistent access to healthy meals, it's one of the easiest and most cost-effective ways we can support kids and their families. And HB 5144 is a meaningful step towards a future where no kid and their ability to learn depends on their family's income. So I thank you for your time and consideration, and I respectfully urge you to pass 5144.
Thank you. Anybody have any comments? You're all set. Thank you.
Thank you.
Up next is Milana Rogers-Burson. Are you here? There you go. I figured everybody was waiting for somebody back there to come up and testify. Go ahead.
Good morning, Senator Austin and esteemed members of the Appropriation Committee. My name is Milana Rogers-Burson. I live in Hartford, Connecticut. I'm a founder of the Connecticut Food Sovereignty Collective, and I also work at the College of the Environment at Wesleyan as Program Manager for Food Justice and Environmental Justice. I strongly support HB 5144, an act concerning funding for school meals, alongside my student who spoke earlier, Joe Almond. I have the privilege of working with a lot of different students from various states, and so get to learn about things like she talked about, what's happening in other states that's working. And it's, you know, I do want to highlight that Massachusetts and Vermont are spending double what we are per capita for food security measures. And so it just highlights what we can do better, and also seeing like specific examples of how we could fund those things. For example, like the Massachusetts Fair Share tax, which I know Connecticut for All has a packet of bills. They had a hearing a few days ago on the Finance Committee to talk about a package that could fund a lot of things like universal school meals, but also beyond that, lots of other food security measures that we need, including, you know, filling gaps around SNAP benefits. So you've heard, you know, the statistics, the level of food insecurity, but again, the fact that we are spending half as much per capita around food security. We also have, you know, Black and Latino residents experiencing twice the rate of food insecurity as white residents in our state. I also want to highlight that with the SNAP cuts around eligibility changes with HR 1, we also know that food insecurity is going to rise in our state, and that also affects the community eligibility provisions for towns. So we may see towns that currently qualify for community eligibility provisions not being able to be part of the program down the line. So this could become an even bigger crisis, in our state. Again, students, both high school and college students, are experiencing very high rates of food insecurity. There's 38% of UConn students, for example, are food insecure in Connecticut. And I've gotten to work in many school systems, both in the greater Hartford area, but also in rural Northeast Connecticut, where I'm from, and experience how students are struggling to access nutritious food. They often rely on nutritious meals at school when they do not have access to quality food at home. And also in my role, I get to work with food advocates across the state and just see the tireless work that people put into filling those gaps, both like for children, for families, and community members, where, you know, state and federal government are not providing the food that people need. I just want to again point to states like Massachusetts, who already have universal school meals. It's the bare minimum for us who are working towards food access for all of our residents, and it's a first step towards, you know, greater food access programming in our state. So thank you so much.
Thank you. Any comments? Seeing none, you're all set. Okay. Have a nice day. Up next is Tanisha Signor. Okay. Joshua Caskey. Is that you, Joshua, back there? Are you? No? Joshua Caskey? Madam Administrator? No? All right. Going back one more time to Jelani Ustani. Not here. So we are going to end the public hearing. And apologize.